Well, I did an audition rotation when I was a fourth-year student, and I was just absolutely impressed with the senior residents. I would watch them, even the interns, but the senior residents in particular were very confident, they were competent, and it just seemed like they were comfortable in the uncomfortable. And I just knew that if I worked hard and I finished through a program like this, that maybe I could be someday just like them.
I think the way medical education is going, a lot of emphasis is placed on the boards, which is, I mean, you need to pass the boards and that's important, but ultimately I wanted to be a great doctor, not just pass boards. So I felt like coming to Grandview, with the training and everything I got, I had no problems with boards, but also I felt like I could become that great doctor that I wanted to become, being around great doctors.
I think the students like coming here because it is a smaller institution. They don't get lost in the very major tertiary centers. I think the other thing that's a selling point here is that we're very strong into allowing residents to do procedures here. And that is something that the residents really want to do. But we are doing things such as central lines, running ventilators, doing thoracentesis, intubating, art lines, and I think that's a huge selling point for the students.
We have a very unique blend of patients that we get here. We are the only hospital in the west side of Dayton currently, and we are a food desert. There's really no grocery stores or anything like that around. And so the type of patient population that you get is more the indigent population. They come in, it's very common, unfortunately, to see 30-year-olds coming in for heart attacks and strokes and things like that.
And I think we serve one of the largest, underserved population in Dayton. I think that's the beauty of the Cassano Clinic, because part of your training is not just being in the hospital, but you also have to meet so many hours or so many patients by the end of year 3 or 4 years that meets the requirements for you to go out and practice in private practice. What a opportunity to be able to serve underserved patients but still allow training for residents along all specialties. If you look at a lot of the clinics out there, they're all primary care or internal medicine or one specialty. We have a broad spectrum of specialties, from nephrology to orthopedics to general surgery, family practice, internal medicine, so we can maintain continuity of care in these patients.
And Cassano Clinic really allows you to kind of hone in your craft, while after you've seen all 20 different attendings approaches, you end up taking bits and pieces of each of them and really start implementing how you want to be as an attending physician when you're starting to see your own patients. So Cassano Clinic really offers, I think, that unique experience for a resident, and I don't think every program has that.
It's a very friendly family here at Grandview. It's a culture that you can't really explain, you just have to feel it. But I will say that we all know each other on a personal level. I think we're blessed in that sense. And I think getting to know each other outside of the residency has really helped for when tough times do come up. Unfortunately, we were challenged as a residency over the last year. A lot of our residents did go through some personal hardships within their family life, some losses and some surprises even in their own health. And they were really there for each other.
It was hard, but we made it through. If someone needed to be off for something, we would have to cover the shifts. And, we tried to kind of work that out amongst each other. And if it got too much, we would speak up. There's a whole team and a little family here that, once they want you to succeed.
Medicine is truly a science plus an art. And so the science can be taught from the books, it can be taught, passed down, but the art really comes from learning with your mentors and the physicians. That they teach you how to really do things well and how to be with patients, how to listen, how to diagnose. It's very normal to have, sit-down conversations of patients, or even the physiology behind what we were seeing at lunchtime, in the halls, in passing. The consultants often take the time, to just teach for a couple minutes here and there to the group of internal medicine residents walking by. And I think that that's really unique. It's impressive.
I'm proud to round in the hospital and see doctors who are attendings now, how they were at one time my residents or they were interns under me, into seeing how they're practicing medicine and how they're carrying on that tradition of teaching other students and residents. So, I'm very proud of that. That makes me feel good when I go home at night, to feel that I had a part of that in their training.
This is a very, very hands-on program. It's kind of a hidden gem. I mean, the pathology I've seen, you don't just get someone with a stroke. You get someone that has a clotting disorder as well, and they've now had 4 strokes. Or, you maybe get a GI bleed, but, they're also in, atrial fibrillation and liver failure and everything else on top of it. So you get to manage some very complicated patients, and you get used to that. And if you can do a lot of the complicated patients and you get trained very well in critical care, I'm actually very comfortable doing critical care. And I think if you can do that, you can do about anything in medicine. So I think that's the biggest thing. It's just very hands-on. It's definitely thinking of the whole person as each patient. And I don't know, I'm very thankful for the experience that I got, and I don't think I would have gotten it anywhere else.